This is Lisa. I'm going to be doing my newborn exam. This is a 3-day-old newborn baby girl born at 39 weeks by C-section due to breech presentation without any complications during delivery. The mother had prenatal care during her pregnancy without any complications. The baby is breastfeeding well, approximately every 2 hours. She is having multiple wet diapers and about 8 yellow seedy stools per day. Her rectal temp is 36.9. Weighed her with only her diaper on at 3,869 grams. And then her height. Her height is 52 centimeters. And then her head circumference from the occiput up to the front is 35 centimeters. As a general observation, she's quite awake. Her skin is pink and warm to touch. There's no signs of distress or difficulty breathing. She does not show any signs of jaundice, rashes, or lesions. She is in a normal flexed posture. So first to inspect her head. Her head is asymmetrical in shape, no edema or bruising or any lesions noted. She has her anterior and posterior fontanelles are open and flat. She does have a strong Moro reflex that is symmetrical. Her neck has full range of motion without any webbing, and no crepitus edema to her clavicles. Her eyes are symmetric and in a normal position. There's no eyelid edema. She has clear sclera without any jaundice or discharge. Nice. Checking for red light reflex present in both eyes. As far as her ears, they are symmetrical, no obvious malformations. External ear canals are patent. No swelling, pits, or tags. And then the pinna are situated at the level of the outer canthus of the eye. So her bilateral nares are grossly intact. Symmetrical and patent, no nasal flaring. Her mouth has no obvious signs of cleft lip, and using a gloved finger, I checked the hard and soft palate for any to make sure that isn't intact, and she also has a strong suck reflex. She's able to, and no natal teeth. She's able to move her tongue freely past the level of her lower lip. Her chest is symmetrical with a normal contour. There's no retractions or use of accessory muscles. So listening to her lungs. And also on the back side. are clear to auscultation. No adventitious sounds. And then counting her respirations for 1 full minute. And her respiratory rate is 52 breaths per minute. And then listening to her heart sounds. You hear S1 and S2 without any adventitious sounds, including any murmurs. And I'm going to listen to her apical pulse for a full minute. And her heart rate is 148 beats per minute. Her brachial pulses are strong and equal. And then going into listening to her abdomen. Bowel sounds are present in all 4 quadrants. Her abdomen is round and soft. No obvious masses. Her liver is at the right costal margin, and the spleen is not palpable. The umbilical cord is clean and dry without any outpouching. And then check her body, take her diaper off. So I'm going to check her femoral pulses here. One after the other. They are equal and strong, and then comparing to her brachial pulse, they are equal. And then checking the labia for any, the labia is pink with some swelling, no discharge or skin tags. And then her extremities are symmetrical with full range of motion and good tone. She has 10 fingers and 10 toes without any malformation. She has good palmar and plantar reflexes, and a little difficult to do on this doll, but a negative Barlow, and then Ortolani. It's negative, no clunks. And then looking at examining her back, it's symmetric without any dimpling, cysts, or tufts of hair. The spine is palpable without any abnormal curvature. And the baby has good muscle tone and good head control. She has appropriate rooting reflex on both sides, and then also she has a positive step reflex is present. So the plan of care for this baby is a hip ultrasound in 4 to 6 weeks due to the breech presentation at birth. Continue breastfeeding on demand every 1 to 3 hours and watching for cues. Continue to expect the baby to sleep every 1 to 3 hours. Give the baby vitamin D, 400 IU daily. And calling the office if the baby is excessively fussy or eating all the time continuously. If the baby is sleeping too much or not enough. If the baby has decreased wet diapers. Decreased bowel movements are okay. Return to clinic at 2 months or sooner if any concerns arise, such as a fever. At 2 months, she will get more immunizations, including the second hepatitis B, rotavirus, DTaP, Hib, pneumonia 13, and inactive polio. Some anticipatory guidance would be protect the baby's skin from the sun, never leave the baby on an elevated surface, make sure the baby is in a rear-facing car seat that is properly installed, never shaking the baby, keeping firearms locked away safely, monitoring the umbilical cord for any swelling, redness, drainage, and then a bath with submerging the umbilicus is permitted after the umbilical cord falls off. And then assess for any smoking, food security, living situation, and family support at home with the parents.